Hello, my name is Dr. Smith.
Hi.
Hi. Can I just confirm your name and your age, please?
Yes, Alice Southwell and I'm 25.
Fantastic. So, today I've been asked to examine your right hip and groin area. This will involve me first observing you walking up and down the room, then inspecting both hips, then feeling around the hips for any tenderness or swellings, and finally assessing the movements of the hip. Does that sound okay?
Yeah, that's fine.
Fantastic. Just before we start, can I ask, have you got any pain at all?
I don't know.
Fantastic. So, the first thing I'd like you to do, if that's okay, is if you could just walk to the end of the room and then back again. So you're back there, if that's okay. That's fantastic. So here I'm observing the gait cycle, looking for any signs of asymmetry, looking for the smoothness of the turning, and also noting any signs of discomfort, of which there are none. Okay, so next of all we're going to inspect the hips. First of all, from the front, what I'm looking for is looking for any obvious scars which we might need to expose. Then looking at for any pelvic tilt, and finally for any wasting of the quadriceps, of which there are none. And if you can just turn to your side for me, if that's okay. Next thing we're looking for is just examining the lumbar lordosis at the back, observing the presence of any knee flexion, and then looking at the foot arches. And finally, the inspection from the posterior aspect, we're looking at the iliac crest alignment. We're looking for any scoliosis at the back, and finally assessing for any obvious wasting of the gluteal muscles, which is none. That's great. Okay, so that completes our inspection. So next we're on to palpation, if that's okay. So I'll just ask you to just jump onto the bed if that's okay. If you just lie down flat for me, that's brilliant. So next I'm going to palpate the hips and around the groins for any obvious tenderness or swellings. If you can just let me know if you've got any pain at all, that would be great. And this is to detect certainly any focal tenderness, which might give us clues as to where the pathology is coming from, if there is any. So the first thing we're going to do is palpate the femoral and then inguinal regions for any obvious lumps or swellings that could indicate a hernia. Any presence of this we might want to confirm with a cough impulse as to whether those lumps are due to hernias. And next we're on to the bony landmarks of the hip and the pelvis. So first of all, palpating the anterior superior iliac spine where the sartorius inserts, moving down to the anterior inferior iliac spine where the rectus inserts for any tenderness there. Moving more medially, we're then going across to the pubic rami, which can be tender in stress fractures, and then over the symphysis pubis, which can be tender in osteitis pubis. And there's no tenderness there, which is great. Next we're moving on to the medial aspect of the hip. So I just turn and just slightly externally rotate the hip to examine here. Here we're looking for any tenderness in the adductors, which could indicate inflammation. Also numbness in this region could indicate entrapment of the obturator nerve, which would need to be noted. Okay, next if I can just ask you to lie on your side, just facing away from me, if that's okay. That's great. Here we're going to palpate around the iliac crests. Tenderness here could indicate the presence of apophysitis. Then we move on to the greater trochanter. Tenderness here could indicate a bursitis, of which there's none. And then going on to the buttock, especially if there's any kind of pain in the buttock in the history. Here we're feeling for the ischial tuberosity, which is where the hamstring tendons insert. And finally, just proximal to that would be the sciatic notch, where the sciatic nerve exits, and certainly any pain radiating down the legs, that might elicit some tenderness. Okay, that's great. You just slip back onto your back if that's okay. So that completes the palpation, and now we're on to assessing the movements of the hip. So first of all, we're going to just check for an active flexion of the hip. So Alice, if I can just ask you to just raise this knee up towards the chest as far as you can, There we're after approximately 120 degrees of flexion if we can get it, which that's pretty good. Next we're on to, well, we'll actually compare all of these movements with the contralateral side. That's fantastic, thank you. Next we're on to passive flexion of the hip. Again, just going up there, trying to get maybe a little bit more than 120 if we can, which we can, that's great. The next movement will be a passive adduction, adduction. Should be able to get 30 degrees there. And abduction, should be able to get about 45 degrees there. That's great. Again, comparing it with the contralateral side. Next two movements would be internal and external rotation of the hip. The most basic way of examining this would be a log roll, which can sometimes elicit pain in the presence of a stress fracture or any obvious problem, but really to assess internal and external rotation we need to flex the knee and the hip to 90 degrees, and then we're first internally rotating, should be able to get about 40 degrees of rotation there, and externally rotating the hip, should be able to get a bit more there, about 45 degrees. Usually, again, comparing it with the other side. Fantastic. And then just to complete the assessment of the movements, if I just ask you to lie on your front, if that's okay. The final movements is to just assess the extension of the hip. Here it just involves a straight leg raise off the bed, and we should be able to get about 20 degrees worth of hip extension there, and that should be the same on both sides. That's fantastic. Right, I can just ask you to turn around again, please, if that's okay. So the next part of the examination, we're going to do some manual muscle testing to test for the power and the function of the muscle groups around the hip and the groin. So the first of these is going to be testing the flexors. So I can just ask you to raise this your right leg off the ground and don't let me push it down. That's great. So with the knee extended, that checks the quadriceps. I can also test for, now with the knee bent, if you can just pull up against my hand, that checks for the power of the iliopsoas muscle. Fantastic. That's great. Now if you were going to check the adductors, so you can just squeeze my hands in for me. That's great. And then the abductors, if you can push them out. Fantastic. And then we're going to check for the power of internal rotation. So if you can just, again, put against my hand, just turn your leg in. Fantastic. And then, that's external rotation. And then internal rotation. That's fantastic. Pain on external rotation can indicate a problem with the piriformis and piriformis syndrome, and that's something worth noting as well. Again, if you can flip yourself over for me, if that's okay, Alice, that'd be brilliant. Thank you. Brilliant. And next, we're just going to check for the power of the extension of the hip. So first of all, can you just raise your right leg off the bed? Don't let me push it down. So with the knee extended, that checks for the hamstring strength, and this time with the knee flexed, again if you just pull up against my hand, and that checks the gluteal muscle strength as well, and that's all great. Fantastic. Right, we're done with that, so if I can just ask you to just stand next to the couch if that's okay. So far the examination is normal. At this point we've got a selection of special tests that we can choose. Usually the selection of these tests would be dependent on the presenting symptom or the findings from the examination, but for the purposes of today I'm just going to go through a selection of tests which can sometimes be useful. So the first of these is called we'll do the trend elbow test first of all. So here you place both hands on the iliac crests and then ask the patient to stand on one leg. So you just stand on your left leg if that's okay. That's brilliant. So usually the pelvis on the side that the leg is in the air should rise upwards. If it does the opposite and goes downwards, then that can indicate weakness of the abductors on the contralateral side, which are the gluteus medius and minimus, which can indicate underlying pathology such as osteoarthritis, rheumatoid arthritis, or sometimes congenital hip dislocation. The next test we're going to do is called the Thomas test. So I can again just ask you to lie on the couch for me, just on your back if that's okay. So this tests for the presence of a flexure contracture. Quite a simple test. You just put your hand underneath the back, and then again passively flex the hip, and you're looking for a loss of lordosis of the back together with the presence of being able to keep the contralateral leg flat on the bed. If they're unable to do this and the leg raises, that's a positive test and can indicate a flexion contraction. The next selection of tests can help indicate the presence of sacroiliac dysfunction. And the first of these is the stalk test. So again, if you can get up on your feet, I'm making you work a bit today, Alice. Sorry about this. That's great. So the stalk test is a combination of asking the patient to, if we're doing the right, so stand on your right leg, if that's okay. That's fantastic. And then supporting the patient, you can now arch your back and lean backwards. And again, pain, that's fantastic. Pain in the sacroiliac joint could be will be a positive finding there. The second test for sacroiliac dysfunction is called the Faber test. So again, back up on the couch if that's okay. Faber stands for putting the hip into flexion, abduction and external rotation. And pressure into that movement could reproduce pain in the sacroiliac joint again, which would be a positive for side joint dysfunction. The third test is called the lateral compression test. Here, if you can line your side for me, Alice, if that's okay, just facing away from me. Here, putting lateral compression into the bed, again, could produce pain in the sacroiliac joint, which again is a positive sign. Okay, that's fantastic. The next set of tests is to test for the presence of a stress fracture in the hip. Usually the presence of this would cause pain in the anterior hip or the groin, and that pain can be exacerbated by percussion of first the heel, the knee, or across on the greater trochanter. And the other way of another movement which may elicit or exacerbate that pain is at the extremes of internal and external rotation. The final test that I'm going to do to complete the examination is to test for the presence of a labral tear. This test is quite similar to McMurray's test, and what you're trying to do is to apply axial compression to the to the hip, and then in extremes of movement, so extremes of internal and then external rotation, and flexion and extension, you can elicit a popping sensation or a clicking sensation, which can be felt or heard, and that can indicate that you've pinched the torn labrum against the femoral head, which is a positive sign. So that completes the examination. Thank you very much. You can stand up if you like. So today we did a hip and groin examination of Alice, a 25-year-old female. She had a normal gait. On inspection, there was no obvious deformities of the hip or the groin. On palpation, there was no obvious tenderness or swelling, and certainly no signs of any obvious hernias in the femoral or inguinal regions. And finally, she had a full range of active and passive movements, and all of the special tests that we did today were negative and normal, which was reassuring. So this was a normal hip exam. Dependent on the presenting symptom or the signs found on an examination, we might want to complete the examination by examining the knee or the back, so the joints above and below, and also possibly doing a full neurovascular examination of the lower limbs. In addition, if there was any available rate imaging of the hip, then that may also be useful to make a diagnosis. Okay, thank you.